After reading through the comments, which I always do inevitably, although it's hard to respond to all of them, a question that I see pop up all the time is the difference between having polycystic ovarian syndrome and perimenopause. And in this video, I'm going to go over what is polycystic ovarian syndrome, or PCOS for short. And I'm going to tell you how, in one easy step, you can tell the difference between PCOS and perimenopause if you watch all the way to the end. So if you're interested in learning about that in this week's video, stick around. Happy 2022 to everyone. I am so excited to see what this year is going to bring. If you don't know me, I see patients on a consultative basis for menopause at the Brigham and Women's Hospital in Boston, Massachusetts. And if you're interested in seeing me in person, I will drop the link to that below. Or if you want to still work with me, but I'm a little bit far for you, then definitely consider the Reclaiming Menopause Masterclass. The link for that is also in the description bar, and I'm going to tell you more about that also at the end of this video. Without further ado, because I know people really hate long intros, let's talk about PCOS. So PCOS is a condition that I think is really important, and it's one of the most common endocrinopathies in reproductive age women. And an endocrinopathy means something wrong in the endocrine system. There's still so much that scientists, researchers, and doctors don't know about PCOS, but let me start with first teaching you how you can make the diagnosis. It's actually really easier than you think and really doesn't involve all that much. So you have to fit 2 out of 3 of the following criteria. The first is irregular periods. Now, most people certainly do have irregular periods, especially when they're younger. And the reason we have irregular periods as we are going up in age is because the hypothalamus pituitary ovarian axis, or the HPO axis, is still maturing. So it's normal in your early and late and even early 20s to have irregular periods. But if you are noticing just a lifelong pattern of irregular periods where it's like 3 months or 2 months, and then you get 2 or 3 in a row, and then not another period for 6 months, that is really considered irregular bleeding, and that should definitely be noted, and you should talk to your doctor about that. The second criteria that makes this, that could make it PCOS, is signs of elevated testosterone. Now, this can be either clinical signs, meaning what the doctor will see, and so signs of elevated testosterone could be things like acne or facial hair, or it could be actually seeing that you have a high level of testosterone or a precursor, which is DHEA, in your blood levels. So you can easily have those checked by your doctor. The third thing that makes it PCOS, and again, remember you need 2 out of 3 of these things, is what we note as a string of pearls or cysts on a transvaginal ultrasound. So if you only need 2 out of those 3 things, and again, the first one being irregular periods for a prolonged period of time, the second being elevated testosterone, whether it's something that your doctor can see or in your lab work, and 3 being cysts on your ovaries, almost 99% of cases, in my opinion, can be diagnosed by just 1 and 2, leaving you not have to go through an ultrasound. The reason I don't love doing the ultrasound is just because sometimes when you're going in for an ultrasound, your ovaries might be super behaving that day, and they may not see that on ultrasound. So if you can find the first 2 things, it's definitely likely that you have polycystic ovarian syndrome. So why do we care about PCOS? Well, again, there's 3 big reasons why we care about PCOS. The first is fertility. So it can be hard to get pregnant if you have PCOS, but certainly not impossible, and is one of the diagnoses of women who are struggling with infertility that's usually one of the highest successors in getting pregnant. So don't be discouraged. The reason it can be hard to get pregnant is because that bleeding that you're having are not really you ovulating and then shedding your lining in sort of this regular pattern. Instead, the uterine lining is just building up, building up, building up, and sloughing off. So if you don't know when you're ovulating, it can be really hard to predict or sync with, a calendar or anything like that. It just can be harder to know when's the right time to have intercourse to get pregnant. The second reason that we care about PCOS is that over time, if left untreated, it can increase your risk for metabolic syndrome. So metabolic syndrome means a couple of different things. It means high blood pressure, elevated cholesterol, signs of an elevated A1C or pre-diabetes into diabetes, and obesity. Really, actually, metabolic syndrome is having 3 out of 4 of those, but don't worry about those little nuances. We want to keep you healthy. And the reason that metabolic syndrome is concerning is because that can increase your risk for cardiovascular diseases and really important chronic diseases as you get older. So recognizing that you have PCOS earlier rather than later is going to be super important in keeping you healthy in the long term. The third reason that we care about polycystic ovarian syndrome is because, again, over time, if left untreated, can increase your risk for uterine cancer. And the reason that can happen is just because of those irregular, not even periods, right, but irregular bleeding, and therefore just the irregular hormones that your uterus is seeing. So it may be seeing a little bit more estrogen than progesterone, and over time that can increase the risk that 1 or 2 of those cells in that uterine lining is going to go haywire and increase your risk for precancer or cancerous conditions. So that's why we really care about PCOS. If you think that you might have the diagnosis, be sure to talk to your doctor about this. Now, why are we talking about PCOS versus perimenopause? Well, they have some very common similarities. Number 1 is the irregular periods. So perimenopause definitely is really characterized in the early and even late stages of having irregular periods. Often in early perimenopause, you're having periods that are coming more frequently, and then as you get into late perimenopause, they're starting to space out a little bit more. And that can really be very similar to the very first thing I talked about with PCOS. Now, the difference between the two most commonly is that in PCOS, you probably have more of a lifelong pattern of this, especially if it was left untreated. And in perimenopause, this may be new to you. So that's one way to sort of tell if it could be perimenopause. Secondly, sometimes in perimenopause, because of stress, you can actually end up with elevated testosterone or signs of testosterone on your face, like acne. That's actually a really common reason. So when we're really stressed, the signal gets to our adrenal glands, and our adrenal glands send us cortisol and actually testosterone. And that testosterone can also cause you to see elevated levels in your bloodstream. Again, very similar to PCOS. One of the important ways you can tell the difference between the two, again, is making sure you're journaling and tracking. And especially if you've done this for a very long time, you have a really good baseline that you can go by to be able to compare them and see if there's a difference between your premenopausal years and your perimenopausal years. Now, I said there was an important way that you could potentially tell the difference, especially if you're in perimenopause and as your periods may be starting to space out a little bit more. The difference is going to be in something called your follicle stimulating hormone level, or FSH for short. Now, when you have PCOS and you're premenopausal, your FSH is going to be very, very low, probably under 10. In perimenopause, your FSH is probably going to be a little bit higher, somewhere between 20 and 35. And if you're even in late perimenopause, where your periods are starting to space out more and more, it could be even higher, like 40 or 50. And those differences in FSH level is one very important way that you can see if it's PCOS versus perimenopause. Tell me in the comments below if you've ever had your FSH checked, if you thought you had perimenopause, but it was actually PCOS. Now, what about treatment? So one of the best things you can do for both PCOS and perimenopause is actually to consider the addition of progesterone to your regimen. Why? Well, let's start with PCOS. In PCOS, one of the hormone irregularities or abnormalities is that there can be a little bit more estrogen that the uterus feels or sees than progesterone. And again, that's what can increase that risk for uterine cancer. So adding a progesterone can be really, really helpful to balance those hormones. So there's many ways to add a progesterone. You can do it in combination with an estrogen, which is considered birth control pills. So birth control pills can be a good treatment option for PCOS. or you could add a progesterone only pill such as Micronor. That's another option that you could use. And there's a couple other ways that you can use progesterone for PCOS. And in perimenopause, progesterone can also be particularly helpful. It could be in either of those forms, a birth control pill or a progesterone only birth control pill, or it could also be in the form of, say, micronized natural progesterone or prometrium. That can actually help kind of calm some of that irregular bleeding, as well as just help some of those symptoms overall. So one of the take-home things that you can also learn from this video is that progesterone is a really great thing that you can add for either of those diagnoses to keep you healthy and keep your symptoms a little bit better controlled. Okay, I promised I would tell you more about the Reclaiming Menopause Masterclass. This is a course for women who are either in perimenopause or menopause and interested in figuring out if hormone therapy is the right option for them and how to do it, or you might already be using hormone therapy for either of those, perimenopause or menopause, but not feeling very educated or empowered or that's actually working. If that is you and you want to work with me, definitely consider the link in the description bar below where you can check out just more about the class, and you will even get a call from me. I'm so excited to watch this channel grow. Thank you so much for subscribing. Your subscription really means the world to me, as well as if you could share it with friends or family members or on any of your platforms that you find helpful. As this channel grows, that gives me more ammo to make sure this channel maintains a really high priority. I love being able to give this kind of free resource to y'all. So if you like it, please let me know and please subscribe to the channel. All right, guys, I'll see you next week for a brand new video. Thank you again so much for all your support. Bye, everyone.